Welcome to another episode from the Veterinary Research Channel. Today, we delve into a significant piece of research published in the Journal of Veterinary Internal Medicine in 2023, which investigated how well healthy adult dogs tolerate long-term supplementation with cannabidiol, more commonly known as CBD. As many of you know, CBD has garnered considerable attention for its potential therapeutic benefits in our beloved companion animals. Shorter studies have previously suggested that CBD is generally well tolerated by dogs, with only mild side effects being observed, notably an increase in the activity of an enzyme called alkaline phosphatase. However, there is a clear gap in our understanding regarding the safety and tolerability of CBD when given over extended periods. This is a crucial area, as many conditions for which CBD might be considered, such as anxiety, osteoarthritis, and epilepsy, are chronic in nature and would necessitate long-term treatment. Recognizing this need for more comprehensive data, a team of researchers at Colorado State University embarked on a study to specifically assess the long-term tolerability of CBD in healthy adult dogs. Their primary question, or hypothesis, was whether CBD would indeed be well tolerated by these dogs when administered orally for a substantial duration of 36 weeks and at dosages relevant to potential therapeutic use. They anticipated observing an increase in alkaline phosphatase activity consistent with previous shorter-term studies, but they were particularly interested in whether this increase would be accompanied by any signs of liver dysfunction or other indicators of intolerance. This research was funded by Hill's Pet Nutrition, a company involved in animal health. To answer their question, the researchers enrolled 18 healthy adult beagle dogs. Beagles are often used in research studies due to their consistent size and temperament. These dogs were carefully divided into 3 equal groups of 6. One group served as a control and received a placebo, which consisted of medium-chain triglyceride oil without any hemp extract. The other 2 groups received CBD orally once daily for 36 weeks, alongside their regular food. One of these groups received a dosage of 5 milligrams of CBD per kilogram of their body weight each day, while the other group received double that amount, 10 milligrams of CBD per kilogram of body weight per day. Before the study began, the dogs were given a 3-week period to adapt to their housing environment. Throughout the 36-week treatment period, the researchers meticulously recorded any adverse events observed on a daily basis. Furthermore, to monitor the dog's internal health, blood samples were collected every 4 weeks to analyze their blood biochemistry profiles. This allowed the researchers to track changes in various health markers over time. The data collected was then subjected to rigorous statistical analysis to determine the significance of any observed differences between the treatment groups and the control group. Now, let's turn our attention to the findings of this comprehensive study. The researchers closely monitored the overall health of the dogs through regular physical examinations, complete blood counts, and the aforementioned blood biochemistry analyses. Encouragingly, the dogs generally maintained good health throughout the 36 weeks. Interestingly, the researchers observed that the dogs in the placebo group tended to gain more weight as the study progressed, and subjective evaluations of their body fat index also indicated a higher frequency of dogs in the placebo group becoming slightly overweight. While there was a trend towards weight increase in some dogs across all groups, the data suggested that the CBD itself was unlikely to be the cause of this weight gain. Instead, it was more likely attributed to the controlled feeding regimen aimed at maintaining a healthy condition, coupled with the use of food rewards during daily enrichment activities. In terms of adverse events, the most common observations were related to the gastrointestinal system, and importantly, all observed adverse events were classified as mild. Notably, the group receiving the higher dose of CBD, 10 milligrams per kilogram of body weight per day, experienced a significantly higher frequency of soft feces compared to both the group receiving the lower 5 milligram dose and the placebo group. The frequency of soft feces in the lower dose CBD group was similar to that of the placebo group. Other gastrointestinal signs such as straining, increased urge to defecate, and occasional vomiting were also noted across all groups, but the frequency of vomiting was low and did not appear to be related to the CBD treatment, as it occurred in similar numbers in the placebo group. Other less frequent adverse events, such as mild dermatological issues and a single case of foreign body ingestion, were also recorded but were not considered to be related to the CBD supplementation. One of the key findings, consistent with previous research, was the significant impact of CBD on the activity of alkaline phosphatase, or ALP, in the blood. The dogs in both CBD treatment groups, receiving either 5 or 10 milligrams per kilogram of body weight per day, exhibited overall higher ALP activity compared to the dogs in the placebo group. This increase in ALP activity became apparent relatively early in the study, tending to plateau after approximately 8 weeks, although individual dogs still showed some variability in their ALP levels throughout the remainder of the 36 weeks. While both CBD dosages led to this increase, the average ALP activity tended to be greater in the group receiving the 10 mg dose, although this difference was not statistically significant compared to the 5 mg dose group. It is important to note that one dog in the higher dose group showed markedly elevated ALP levels, ranging from 7 to 10 times the upper limit of the normal reference range for a significant portion of the study, before returning to a non-clinically relevant level after the study concluded. Despite the notable increase in ALP activity in the CBD-treated dogs, the researchers found that the majority of other blood variables measured throughout the 36 weeks remained within their normal reference ranges and were not significantly affected by the CBD treatment. Specifically, another liver enzyme, alanine aminotransferase, or ALT, remained within the normal range for all treatment groups throughout the study. Interestingly, the same dog in the high-dose group that showed the high ALP levels also had a transient increase in ALT activity at one time point, which subsequently returned to normal. Aspartate aminotransferase activity was statistically different between the groups, being higher in the 5 mg per kilogram group than in the 10 mg per kilogram group, with the placebo group falling in between, but all values remained within the normal reference range. Other markers related to liver function, such as albumin, gamma-glutamyl-transferase, fasted bile acids, and postprandial bile acids, did not show any significant differences between the treatment groups and the placebo group. Similarly, a comprehensive analysis of complete blood count parameters and other blood biochemistry variables did not reveal any significant changes attributable to the CBD supplementation. The researchers then delved into a discussion of the implications of their findings in the context of existing knowledge about CBD in veterinary medicine. They highlighted the scarcity of long-term tolerability data for veterinary CBD products despite their increasing availability. The chosen dosages of 5 and 10 mg per kilogram of body weight once daily were based on dosages that had been previously tested in dogs and on dosages found to have anxiolytic and anticonvulsive effects in humans and rodents. The CBD product used in this study was a broad-spectrum hemp extract, meaning it contained not only CBD but also other non-psychoactive phytocannabinoids like cannabidiol and cannabidiol, as well as cannabichromine. This extract was formulated in a medium-chain triglyceride oil vehicle and, importantly, it contained less than 0.3% delta-9 tetrahydrocannabinol, or THC, the psychoactive component of cannabis, with THC being non-detectable in the final treatment oils. The presence of these other plant compounds, such as terpenes, is thought to potentially enhance the therapeutic effects of CBD through a phenomenon known as the entourage effect. This concept suggests that the combined action of various cannabinoids and terpenes may be more beneficial than CBD alone. When comparing the adverse events observed in this study with those reported in other research, the researchers noted that studies involving higher doses of CBD, particularly in combination with THC, have reported more pronounced side effects such as nausea, vomiting, lethargy, and incoordination. In contrast, shorter-term studies using broad-spectrum hemp extracts at various dosages have generally reported no or only mild adverse events, consistent with the findings of this long-term study, where the primary observation was an increased frequency of soft feces at the higher CBD dose. The researchers carefully considered whether the higher concentration of hemp extract in the 100 mg per milliliter oil, used for the 10 mg per kilogram dose, might have contributed to the gastrointestinal upset, and statistical analysis suggested that a single dog prone to soft feces did not significantly bias the overall results. Interestingly, the study did not involve formal neurological examinations, but no overt behavioral changes were noted by the study staff during general physical examinations or daily socialization of the dogs. The controlled environment and high-quality diet provided to the dogs likely contributed to their overall well-being, as reflected in their body weight, body fat index, and general blood variables. Another long-term CBD study assessing daily life quality scores also found no differences between control and treatment groups in various domains such as happiness and energy levels, which aligns with the lack of notable behavioral changes in this study. The observation of increased alkaline phosphatase activity was a significant finding that warranted further discussion. The researchers compared their results with another long-term study that administered a CBD distillate at a lower dose of 4 mg per kilogram once daily for 6 months. That study also reported an increase in ALP activity that plateaued earlier than in the current study. The average ALP activity in the current study, particularly in the 5 mg per kilogram group, was notably higher than in the other long-term study, which the researchers speculated might be due to the different forms of CBD used, broad spectrum versus distillate, or the slightly higher dosage. Comparisons with shorter-term studies using similar CBD dosages also revealed variability in the magnitude and timeline of ALP increases, potentially influenced by factors such as the specific CBD formulation, frequency of administration, the vehicle used to deliver the CBD, and even the breed or size of the dogs. It is crucial to understand that alkaline phosphatase is an enzyme found in various tissues in the body, including bone, intestine, and liver. Therefore, an increase in ALP alone does not definitively indicate liver damage. However, given that CBD can interact with liver enzymes in humans, the researchers emphasize the importance of monitoring liver function in dogs receiving long-term CBD supplementation. Human studies involving very high doses of CBD have reported increases in another liver enzyme, ALT, and in some cases, evidence of drug-induced liver injury. In contrast, this study in dogs, at the tested dosages, did not show evidence of hepatic damage based on the other liver biomarkers measured, such as ALT, AST, and bile acids. Only one dog in the high-dose group had a transient, mildly elevated ALT level. In conclusion, this 36-week study provided valuable insights into the long-term tolerability of oral CBD supplementation in healthy, adult dogs. The researchers found that a dosage of 5 mg of CBD per kilogram of body weight administered once daily was generally well tolerated, with a similar frequency of soft feces and diarrhea compared to the control group and an overall increase in serum alkaline phosphatase activity that was not accompanied by changes in other liver function tests. The higher dosage of 10 mg per kilogram per day was associated with a greater frequency of abnormal fecal scores, and although the mean ALP activity was higher, it was not statistically significantly different from the lower dose group. The study's authors concluded that while chronic administration of CBD at 5 mg per kilogram once daily appears to be well tolerated in healthy dogs, the higher dosage should be used with caution. They strongly recommend monitoring liver function in dogs receiving CBD chronically to ensure that no other abnormalities develop, especially in dogs with pre-existing health conditions or those taking other medications that are also metabolized by the liver. If liver function tests do become abnormal, they suggest that the CBD dosage should be reduced or discontinued. Finally, the researchers highlighted the need for future studies to investigate the long-term tolerability of CBD at different dosing intervals, using various formulations with different cannabinoid profiles and delivery vehicles, and in a more diverse population of dogs, including different breeds, ages, and sizes. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.